the next session, we'll listen to an update on how Thailand gets through COVID-19 situation, balancing between health versus economic concerns. It is my greatest pleasure to invite our honorable speakers, Dr. Phusit Prakongsai, Senior Advisor on Health Promotion, Ministry of Public Health, Ms. Ketsuda Supradit, International Economic Advisor, Fiscal Policy Office, Mr. Kalin Sarasin, Chairman, the Thai Chamber of Commerce and Board of Trade of Thailand, and our moderator, Dr. Soraphol Tulayasathien, Senior Executive Vice President, Head of Corporate Strategy Division, the Stock Exchange of Thailand. Please welcome.
Sawadee krap. Welcome to the first session of Thailand Focus 2020. The topic today, we will discuss how Thailand get through this COVID-19 crisis, especially how we balance between the public health and economic concern. We are quite fortunate today to have our distinguished panelists from government sector as well as from private sector to discuss how we get through this. We like to start off with the public health concern. So I would like to ask Dr. Phusit from our Public Health Ministry to talk about what has been the success factor that we have done that make Thailand quite able to get through this public health. According to the Global COVID Index, we rank number 1 out of 184 countries in dealing with the global COVID recovery. And we would like to know what is the success factor, what more need to be done, and I think the important questions that investors like to know is, will there be the second wave for the Thai economy or not? Please, Dr. Phusit.
Thank you very much. Good morning, everyone. And first of all, I would like to thank the organizer for inviting me and as a representative from the Ministry of Public Health Thailand to share our perspectives and view about how our country can get through the COVID-19 situation and how can we balance between health and economic concerns in this situation. Before I answer, respond to the questions raised by the moderator, I just would like to share with you some information about the current situation in the global situation. Next slide, please. Can I share my slide? Yes. So this is the current situation of the COVID-19 pandemic. You can see that this is the figures or the information system yesterday that we already now have 24 million of COVID-19 cases globally, and around 822,000 COVID-19 related deaths globally right now. And the number of countries affected by the COVID-19 is around 216 countries. And World Bank estimate that there's around $9 trillion of the global economic cumulative loss in 2020 and 2021. So this is the current situation, and you can see in the graphic that the current situation of the COVID-19 cases right now. We have quite a number of cases in the Latin American region and in America and in Europe. And in Europe, I think that we have a pandemic situation in March and April, and then the situation in American regions and Latin America is getting worse. So I think that to answer your second questions on what we have for a second wave, whether we will have the second wave of the COVID-19 situation, I think it's depend on our policy to allow the foreigners or perhaps the tourists to re-entry into the countries in our country, because you can see that there's so many countries that are still in the situation of the pandemic of the COVID-19. So this is the current situation. Next one, please. Okay, sorry. Okay. Okay, ครับ And this one is the situation of the COVID-19 vaccine pipeline. Just would like to share with you that right now we have around almost 200 of vaccine candidates globally, and around 29 of the vaccine candidates right now is in the clinical trial phase. So we expect that in perhaps early of 2021 and or perhaps mid-year of the 2021, we will have one or two or three license of the vaccine COVID-19 next year. So this is the situation that we still the collaboration with the COVID-19 vaccine development. And yesterday, I think that you may heard that the Thai cabinet has already approved 1 billion of the Thai baht of the government budget to promote the vaccine development and perhaps the purchasing vaccine in the global market. So this is the situation, and I think that to answer your second and third questions on the future situation of the COVID-19 pandemic in Thailand, I think that it depends on the country policies and depend on the availability of the COVID-19 vaccine in the global market, and whether we can access to a COVID-19 vaccine in the near future. For the first questions on the key contributing factors to the success of the Thailand health system in controlling the first wave of the COVID-19 pandemic, I think that we have 3 or 4 contributing factors. The first contributing factor is our strong country health system and our long-term investment in health infrastructure and human resource development and production in Thailand. So the second contributing factors, I think that is our strong primary health care system, that we have village health volunteer and we have people participation in controlling the pandemic of the first wave of the pandemic of the COVID-19. And the third factor, I think that we have quite a good leadership from the government and the policy of government to let the public health to lead the country during the pandemic of the COVID-19. So I think that these are the 3 or 4 contributing factors in our success of controlling the first wave of pandemic COVID-19. Thank you very much.
Thank you, Dr. Phusit. So basically, we have saying that the success factor that has led Thailand to be able to control the COVID situation, the existing healthcare system, that availability of the personnel, as well as the universal healthcare, as well as the personal that help volunteer at the area levels, and also the leadership that has taken measure quite promptly and in time. Dr. Phusit also mentioned about the risk of second wave depend on the opening up of the economy, which is quite related to what we will ask our next 2 panelists, as well as the government commitment that passed the cabinet just yesterday, 1 billion baht to help support the vaccine availability in Thailand once ready. So let me now turn on to the economic side. I think everyone would like to know, we know that now we have the strong policy to keep Thai people safe, but do we have the strong policy to keep economic sound or not? So I would like to ask now from the government perspective, Kun Ketsuda, the Fiscal Policy Office Advisor, what is your prospect? What do you think is the economic situation going to be in the next half of this year as well as next year. As you know, the second quarter GDP just came out at negative 12.2%. We would like to know your perspective as well as what has the government done or plan to do to help support the economy. And I think the question that investors are quite interested in is about the fiscal discipline. If we have a lot of stimulus, how can we keep ourselves disciplined fiscally? So please, Ms. Ketsuda, please.
Thank you. So, thank you very much for inviting me to share in this panel. This is my first time on virtual, actually. This is a new normal that we try to adjust. In fact, on the economic side, in the past few months, the government tried to put the priority of health first and then economic later. So as you can see that in the last few months, the government successfully kept transmission of the virus in check. And most of business had resumed the full operation, especially except the hospitality and tourism. This sector cannot open as the international flight has been suspended. As you know, I don't want to say it on the public health because how excellent we have, as we have the expert already mentioned. But I like to talk on the measure and relief package that we have done so far. Despite the fact that we have successfully contained the outbreak, the economy has also taken hard hit due to the suspension of economic activity. As we all know that the GDP of second half of this year minus 12%. This is very, very bad compared to the past. But however, the first priority of the government on the economic side, we try to revitalize, to remedy, and maintain the livelihoods of people. In this regard, let me elaborate the key economic measures undertaken since the outbreak. In order to mitigate the adverse impact of COVID-19 on the economy, the government has introduced 3 phases. Start from March. The total amount of the value of these 3 packages is about 12% of our GDP, which is enormous, as we can imagine. On the phase 1, aim to reduce financial burden to individuals and entrepreneurs, such as reduce contributions on Social Security, both employers and employees. No laid-off can claim a tax reduction for 3 times of employee wages, and relieve burden of utility bills, both electricity and water bills. The government has also launched the debt suspension, debt restructuring, and provide soft loan. On the phase 2, we mainly aim to transfer cash 5,000 baht electronically per month to informal workers affected by the COVID, who is not covered by Social Security Fund. But for the employee covered by Social Security Fund, receive compensation from the fund about 50% of their salary for 3 months if they are unemployed because of the COVID. The Ministry of Finance has also extended the personal and corporate income tax for filing for another 6 months. Moreover, we increased liquidity for individuals. The government extended emergency loan of 10,000 baht per person at 0.1 interest rate monthly, and also special loan 50,000 baht per person at 0.35% monthly interest. And for business, the government has offered help loans up to 3 million baht for SME at 3% interest rate for the first 2 years. And besides, Ministry of Finance has exempted import duty COVID-19 prevention and treatment products, and also provide occupational skill workers who needed to reskill and upskill and so on. I only name only a few. For the phase 3, which is very important, the government has earmarked 1.9 trillion baht budget, which consists of first, emergency loan degree of 1 trillion baht to financially assist farmer, informal workers affected by the COVID-19. There are 3 portions in this. The majority of loan, which is 5,055 billion baht, has gone towards monthly 5,000 baht cash handout electronically for 3 months. So far, 15.3 million informal workers and 10 million farmer household has already received the handout. Moreover, 4 billion baht has gone for economic and social recovery. This is Minister has already mentioned, which aim to stimulate the local economy in the medium and long term. Mostly, we would promote future sustainable growth and revitalize local economy, stimulate household and private consumption, and also stimulate local investment in local project. The last portion is for Ministry of Public Health, I would say. About 45 billion baht has spent for supporting medical workers and medical supply dealing with COVID. And also another 2 degree dealing with done by BOT, which is provide the soft loan, especially for SME, about 500 billion baht, and also executive degree to allow Bank of Thailand to set up 400 billion baht corporate bond liquidity stabilization fund to back up corporate bond market. In addition, just last week, the Cabinet has approved Finance Ministry's proposal to provide about 114 billion baht in soft loans and credit guarantee to help SME as well as individual to provide additional liquidity in order them to keep up their businesses. Especially previously, as SME did not qualify to the soft loan scheme. The recent which just approved last week, it will be discriminatory. This time we have clearly listed type of SMEs, namely general SME, SME in tourism and related sectors, smaller SME, individual, to ensure a wider corporate for most business affected. To relieve financial burden and for business with that, Bank of Thailand together with Thai Bankers Association, the Association of International Banks and the Government Financial Institution Association announced to launch the debt restructuring program for business or DR-BIS program, just launched last week, I would say. The DR-BIS program aims to provide mechanism for multi-creditor business to lessen their debt burden and facilitate coordination among multiple creditors. This mechanism will help expedite debt restructuring through common debt work out practice as a mutual agree by all the creditors, and assigning a leading creditor to coordinate with other creditors, thereby a kind of providing one-stop service. So with this, we hope that would help this situation at the moment for the time being, and the next step we will do I will talk in the next round. Thank you.
Thank you ครับคุณ Ketsuda. Basically, if I understand correctly, there has been a lot of measures given out by the government with concentration on helping the vulnerable sectors, the people, as well as the SME to cope up with the current situations. These measures has been adjusted from time to time. As Kun Ketsuda mentioned, the 2 weeks ago, the measure on soft loan has been adjusted to make it more suitable to the situations. There has been also facilitation for market mechanism to help work. The example would be to be a one-stop that allow creditors and the debtor to negotiate a market way out. As well as there has been some sector specific on tourism, particularly on the strengthen the local tourism for the Thai people to travel in Thailand to help cope up with the lessened demand. So may I now turn to Kun Kalin from the private sector. The private sector has been at the center of both health and the economic situations. I think what most people would like to know is that we have here that the private sector has been advocating the opening up of the economic activities. So we would like to hear your view on how is your assessment on what we have done so far. What could we do more and how can we balance out economic and public health concern? Please, Kun Kalin.
Thank you very much. First of all, I'd like to thank the organizer, SET, and also like to welcome all the audience at home to listen to these sessions. Actually, the private sector play important role since beginning. We see the sign that what happened in Wuhan was, we see that what happened, you come to Thailand. So what can we do? So we have get together among all the top management of many companies in stock market also. We have been talking and how can we help the countries and what can we do, what it will happen. So in the picture we have meeting. At that time we have meeting and we said that if the country is closed, the essential business should be open. So probably end of, I'm not sure, end of February or March, they closed down Bangkok, right? That time. So at that time we voiced out to the government saying that the essential business should be open. For example, the supermarket, drugstore, the restaurants, logistic, import-export business, and also the factory should be open. And the government really listened to this, and they just closed down part of it. And then we also said that maybe some rules and regulation the government has to change very soon. For example, if you close down everything, so people have to connect. So we connect by online. So we have meeting online, but the rules and regulation in the government said no, you have to be in the same room. So we voice out the government should change these rules and regulations. So the government kindly enough changed these regulations so we can be anywhere in the world for the meeting. So this is very practical. And also will be a lot of people still in Thailand for tourists. So maybe we have to extend the visa for them. And also the expat who live in Thailand, maybe they have to extend the visa. So we need to extend the visa very soon for that part. And also they can apply online. And at the same time, when the country closed down, we are very worried about the SME that Kun Ketsuda said already that the measures the government has it. So we work closely with the government, said what type of measures that you should do, and also what can we help fast. So right now a lot of measures come out. So I really like to thank the government. For example, the social securities, reduce our expensive water, electricity bills, and also how can we prolong the layoff of the private sectors. So this is what we voice out to the government. So the government really helped with many billions of bahts. So and after that, we came to government and asked government that what type of help that we can help the government. So and also we asked the doctor. The doctor played a very important part in these events. So we asked the doctor, what do you need? So the doctor said, they really need that how can we take a distance from the patient and the doctors. So we came out with a swapping test room. So and after that, we do it, swapping test room, and also we distribute throughout Thailand. So this is part of it. And also, the doctor said they need the respirator also. The respirator is very important. And so we mapping where the good respirator is cost 1 million baht per piece. And we map out where it is in Thailand and where located, can it be used or not used. And right now we found out that 300 of them cannot use. So we bring in and then fix it and give it back to the government, to each hospitals. So right now it's being used and we test it and prepare for the next wave, what the doctor said. Yeah. So right now it's really come and work together very closely with the government. And then at that time I was appointed to be one of the advisor to government for the, opening up the business. So what we been talking with the government said, you cannot close forever. So the economics and also the health and wellness should come together, not only health issue alone, because the government don't have enough money to take care of the rest of our life. So the government really see this point. So we set up the committees, actually the informal committees, that's including the Mor Kamnon, the Dr. Kamnon is very prominent figures in the Rabat Vitya. And also we have some more Dr. Ketsuda from like NGOs, and also TDRI, Dr. Somkiet, and all Chamber of Commerce and all private sectors. We come to help as informal committees. We help, and then we set up with a basic requirement. So if we're opening up, what the basic requirement we should have. So example, we should have like the alcohol, we have the mask, and also social distancing. Something like this is very basic. And then after that, we have been talking with many doctors and said, how can we do activities? Each activities with low risk and to high risk. We group out which activity be low risk, medium risk, and high risk. We mark as a color scheme, the white color, the green color, yellow color, and red color. So it's communications be easier for that part. And we talking and we do metrics, and then after that, we went to communicate with the national securities, Secretary General of the National Securities, with the militaries, with doctors of health, ministries, and a lot of people come to help. And then we said, okay, what type of things that we open up very soon? First phase, second phase, and third phase. And then if they open the first phase, and then after that we went back to the private sector, what type of activities should be open? So if, for example, the restaurant should be open or something like this open, so the private sector as a trade association, we came and with the standards, what type we should do, distancing, all these, that. And after that, we come with the standards and went to talk with the committees, COVID committees. And once committee approved, so we came out with the infographic and also the clip. So something like this, we came out, every 14 days, we come out with this is example. Each of them is infographic that we came out. So every 14 days, we came out one phase. So this is very, very important that we come together and work together. And at the same time, with the measures, what Ketsuda said, so the government asked us to get a feedback also in the countryside, if these measures work or not work. It works, so after that we can feedback. If not work, how can it work? So we feedback to the government also for this part. I can see that how can you balance the economics and health side. So this is one that we can help for opening up. Thank you.
Thank you ครับคุณกลิน I pick up some 2 or 3 points I think is very central to what we have done to cope the situation. The first one that Kun Kalin mentioned is very interesting that COVID is a national agenda, and it seems like the private sector is not the only one affected, but it's a part of solution that private sector has been involved early on with the government as well as the academia, doctor as well as the economic. Actually, that's why we have the sitting today. You sitting in between doctor and the policy maker on the economic side. So it's a national agenda, and the private sector has been constantly involved. I think that's the first message that Kun Kalin said. The second one is quite interesting because you mentioned about how private sector offer the solution to help doctors, providing the necessity equipments that are sometimes expensive, and in many areas sometimes we don't know where the demands or where the supply is. So that's where the private sector can be the part of the solution to help with the COVID. And the third one that Kun Kalin mentioned was on communications. Two things. The first is how to get feedback to the government. What measures work, what doesn't, and how can we improve. And the second part is that how we communicate to the people, this business, when the city start to open up, what should they do? This is done through infographic. It's quite trendy actually. So I think these are the 3 points that Kun Kalin mentioned. We still have some time, so I would like to ask maybe the second round some specific question, and maybe on the third one we can ask you to help wrap up with some thought for the investor. So let me start with Dr. Phusit. You mentioned about the risk of the second wave, and if you scan in many countries, like for example this morning there was news about one of the country in the north. Let's not name the country. You also mentioned the risk depend on the opening up. I would like to hear your view on what have we prepared for the second wave if it's outbreak, and what should be the right degree of the opening up of economic activities from the public health point of view. Please.
Thank you very much. I think that before I answer or respond to these questions, just would like to thank the private sector and Thailand Chamber of Commerce in providing support and perhaps a contribution and donations to the Ministry of Public Health and our public health system in controlling the COVID-19 on the first wave. I think that this is very important, and this shows that our unity in private sector, public sector, and perhaps with the people will be able to succeed in controlling this pandemic of the COVID-19. So let's just would like to move to your questions on the possibility of the second wave. As I mentioned earlier, that right now, if we look at the situation in neighboring countries or perhaps in other countries, I think that it depends on the government policies that we will open the country or not, and perhaps it depends on our preparedness in controlling or perhaps the measure in trying to strengthen our country state and local quarantine for the foreigners, and perhaps for the migrant workers that we would like to allow them to re-entry into our country. So I think that this depends on our capacity and perhaps our preparedness in controlling or perhaps the country local and state quarantine system in Thailand. And the second thing that we would like to prepare for the second wave is that we try to strengthen our primary care system and our disease surveillance and disease control system at the community and national level. So this is very important for us to control if some things that we call this is perhaps a low or small second wave or third wave that will happen. I think that experience from other countries tell us that perhaps we cannot avoid with the situation of the second wave and third wave, but we can mitigate the negative impact from the another wave or the next wave of the pandemic of the COVID-19. So that's our perspective. Thank you.
Dr. Phusit gave us some confidence that if the second wave comes, we are stand ready with the personnel, with the facility that is available, as well as the experience that we have learned from the first wave, as well as what we observe from other countries. May I turn to Kun Ketsuda? What more the government can do if something comes, and how would we ensure the fiscal sustainability for the Thailand in the medium to long term?
Thank you. I am quite confident, sitting here with the doctor and private sector and myself, as part of government Ministry of Finance. So I feel like we should be okay. I believe that we have capacity to sail through the second wave. With the two or three reasons. First, the economic stability in the past. I experienced 1997 financial crisis, although it's less than this, but I've been through that, and Ministry of Finance and agency involved, we're quite cautious in terms of borrowing, public borrowing or foreign borrowing. So we've been quite very cautious. We haven't borrowed at all in the past. So I would say that the economic stability is well cushioned against both external and internal shock. International reserve are very healthy at about 240 billion US dollar, or about 3.8 times of short-term external debt. This is quite healthy, based on international practice. Our public debt remain manageable level. Accounting for emergency loan degree, the public debt to GDP still stay within fiscal sustainability threshold. As I mentioned, that we haven't borrowed at all, just only few for refinancing or whatsoever. But in fact, since 1997 crisis, our fiscal position is quite healthy. This gives room for us to spend and start borrowing at this time. And I would say that about all the total borrowing that the government have in currently, 98% of public borrowing is domestically. So it's quite a healthy position at the moment. And also inflation is quite low, so it will give the monetary policy space to be utilized. We have the very strong public health system that would would give us confidence that we would go through this. As we have experienced in the past few months, we try and adjust and introduce new measures and adjust from time to time until this time. So we've been through trial, we've been through bird flu. Our public health is very strong. I would say, according to the Global Health Security Index. So we are the best, right, in Asia. Number 6 in the world, and in the first in Asia, right? So we are quite proud of that.
But US is the first.
Wow. That's not, okay. Okay. That on the fiscal and financial side. And then I like to talk on if the second wave happened, I'd like to talk about the resource, about the bullet, what we have to further relieve people affected, if we have. So under the 1 trillion baht, as I mentioned earlier, the first part that for relief people and informal worker, farmers, and self-employed and whatsoever. 555 billion has already allocated. And then and also already, and then about on the 400 billion baht, the disbursement is very few. So we have like 345 billion baht left over to spend if we have, but I don't want to. And so that means we have more than 200 billion baht to utilize if necessary, if it happens. And on the economic recovery, we still have budget about 350 billion baht remaining to stimulate domestic economy. If you remember, 1 trillion baht borrowing, 555 billion that for release the problem, the trouble of people, and 400 for economic recovery. And on the economic recovery, we still we spend very few, very little. So we have some room to spend in order to stimulate domestic economy. And lastly, on the bright side of the COVID outbreak, I would say that as everyone knows that the COVID-19 accelerating the rise of Thai digital economy, and which come earlier than we expected actually. Everyone knows that the new normal world digital transformation is very important for our future. The Thai business will require to adapt in order to remain competitive in the digital economy. So this is why we are on virtual today. And the earlier, luckily actually, the government has invested national e-payment system as additional infrastructure for future businesses. The move has paid off. According to the 2020 edition of United Nations e-government survey, Thailand ranked number 57, moved up in e-government development index, moved up to 16 places from 2018. This is the bright side of COVID. And also, as Finance Minister mentioned this morning, big data and technology will refine our economic policy. At the Fiscal Policy Office, we use big data to a kind of data analytics to analyze and provide recommendation, any measures proposed to the ministers that help a better target, a more targeted assistance, and which is still underserved. Given this recent encounter of COVID-19, there are two main lessons have been learned for finance ministries, I would say. First, it is important to have a strong and accurate database, as well as to have a good and proper infrastructure in place. We have learned a lesson. If it happened, we already have database. We have experience what wrong, what right. So at this time, we would do better. I would say, and that means especially if we have the consolidated database that link national ID, then is it easy to cross-check and verify once in need. The second, luckily we do have national e-payment system or prompt pay in place a couple of years ago. So I have a virtual conference with a member of the ADB, of the World Bank, or the AIIB in the last few months. And we share experience, what we have done so far, what Thailand have done, or what the ASEAN member country have done. Actually, we done pretty good because we have national e-payment system, and then we could target the one who really need it, and also the consolidated, the big data, that helps a lot. I would say we're quite advanced compared to a number of countries in this region. So then that's the way we could help people in need efficiently if it happened in the future. And then to revise the economic growth and stability, I can assure that the Thai authority has put its effort in propping up the economy and achieve optimal growth prior to COVID-19. And I'm confident that our well-thought economic measures and relief package, strong database, as well as ample fiscal resources, and the readiness of healthcare system would help economy avoid the prolonged economic contraction. Although everyone all know that about 17 and 18% of tourism, 12% we rely very much on foreign tourists, 8% only for domestic tourists. And so as you know, we introduced the application เที่ยวด้วยกัน to stimulate local tourists to travel and to spend more in the hotels and tourist and restaurants. Then that although it's not completely compensated with the foreign tourists, but it's helped to some extent. And also we rely very much on export sector, more than 70% that we rely on export sector. But not all of export products has been affected. Some of them still have growth. For example, the food sector, Kun Kalin can assure that only some products. So this is a new normal. It's the way that the country have to adjust for the future, and I think we would go through that. Thank you.
Thank you, Kun Ketsuda. Dr. Phusit has already mentioned that we are ready on the public health front. Kun Ketsuda mentioned that we are also ready if something there's more need for additional measures. She mentioned that there's some room left on the budget that is to be able to spend more. If my calculation is correct, it's about $17 billion additional budget that can be spent. But more importantly, she mentioned that this time the government used big data. So not only experience from the first wave, but also the big data can help better target and make it the measures more effective. And lastly, Kun Ketsuda mentioned that with the new normal, the government also adapt using digital technology like the conference we are doing today, as well as the electronic government, as well as the electronic payment, which is prompt pay. So let me now turn on to Kun Kalin. We have heard about how government adapt. We also have heard from Kun Kalin that the private sector is a part of the solution along with the government. But we would like to hear a little bit more on how has the private sector adapt and opportune for this new normal situations. Please.
Thank you very much. I'd like to answer part of the doctor said that when we opening up, so if we open up too soon with no care, so we have a second wave, third wave coming up. So this is very important. How can we open up with care. It's very important. How can we open up slowly and slowly, because we can ensure that we have second wave, third wave for sure, but how can we control it is very important. So at the moment, so many activities still closed. So the governments, I probably assure the government will help that sector that been affected for the sector that not open yet. For example, right now the opening up is like the hotel. Normally we have income from tourism around 3 trillion baht. 2 trillion baht come from abroad. 1 trillion baht come from local. But right now we can see that 2 trillion baht we lost. Suddenly we lost. So how can we gain this 2 trillion baht from new opportunities or not? Can do it or not, right? So at the same time, the government should help, to support this sector who is not who has been affected. At the same time, we can see that we have a lot of activities and also opportunities that we can see. For example, work from home or digital economy, what Ketsuda said, and the food business is very good. We can see that the behavior of people is changed. So right now, people reluctant to go out that much. We want to go to place that we safe, and also if they can do it, they can go to countryside. So right now we can see that the number of the growth in the manufacturing of agricultural products. For example, the company called Kubota, they do third shift now, and some factory for food factory do third shift also. They do very well, and also some farmers they can grow more and more because people eat more food, more product, and also the products being export and pre-cooked and food like this can go. So only some bright side coming up in the tunnels. So I can see that how can we adapt ourselves in the future. For example, the labor, we have to reskill, retrain them, and we can show them what the future is going to be, right? And also, right now, Thai Chamber of Commerce, we try to, we work together with TAT, Tourist Authority of Thailand, and how can we move forward with what we call the new normal of a happy model, the happy model for wellness. We can see that wellness is one of the top priority of our countries now. People from outside see Thailand as a good hub for wellness and medical tourism. So we can see that the happy model, we can see the first one is eat well, second one live well, third one fit well, and last one give well. So eat well, eat good food, healthy food, clean food. The more you eat, that means the farmer can grow more, right? Okay, the second one, live well. You live in good hotel, standard hotel, and you have activities, maybe Thai massage, or maybe Nang Samadhi meditation, something that you can do like, this is live well. And next one is fit well. Fit well, that means that you exercise, or you have many activities in Thailand everywhere. You go bicycling, running, diving, all many things you can do that. Yeah. And also last one, give well. Maybe you can go and give knowledge to the village people, or maybe you learn from the village people, or maybe you can see what village people doing, for example, OTOP. If they have OTOP, and how you can help them get a product from OTOP and selling anywhere in the world. Is it possibilities? So this is Give Well. So this is the platform that Thai Chamber of Commerce joined with TAT come to help, and how can we expand this happy model abroad also. This is one of the things that we want to push in the future.
Wow, very interesting, very interesting. So the private sector has also adapted not only on the digital or food delivery front, but the new model, the happy model, eat well, live well, fit well, give well, might be the new opportunity for Thai companies and Thai people. Very interesting. I can do the three: eat leave and give, but fit well I may not be able to do. So we still have some time left. I would like the panelists to give some last thought to our investor online. Believe it or not, we have almost 1,000 people watching at the moment, and I think they will be interesting to hear what you advise them, especially on how they should adapt or what are the good opportunities in Thailand for investment. Please, Dr. Phusit.
Thank you very much. Perhaps I would like to support Kun Kalin about how our country economy will adapt ourselves in the new normal situation. So I think this is very important for us as well. Apart from the well-being business, I think that this is very interesting, and from our perspective, as you may know, that our country have the strong and good quality of healthcare system in our country as well. So we start to have alternative hospital quarantine and allow the foreign patients to re-entry into Thailand to get medical treatment in many cases. So I think that this is perhaps another opportunity for us to promote our food and our food product, and perhaps agricultural product, and also the medical services product and service that we can provide to neighbors or perhaps to foreigners patients. So this is my point that I would like to add on the Kun Kalin suggestions. And the second thing is that I think that we have to accelerate vaccine development and availability of the vaccine in our country. So once we have a vaccine available for our people, or perhaps our foreigners who become our tourists, so I think that we can revitalize our economy and our system properly in the future. And the last thing that we aim to have is that we'll try to raise the public awareness and concerns on their behavior. So perhaps try to continue and keep our good sanitation and behavior of the people, such as wearing masks, hand hygiene, and perhaps try to have physical distancing, and not try to avoid social gathering or perhaps any other risk behaviors among the people. I think that this is our roles in the public health sector, that we try to support and try to move forward our system, both public health system and our economy system. So thank you very much.
Kun Ketsuda, any last thought, please, for our investors?
Yes, I think under the phase 3, everyone quite worried about the borrowing, the government borrowing. And this is the main concern of people, as we haven't, some people, if they haven't familiar with borrowing, like in the old day, we borrow a lot in the old day for infrastructure, investment, development, or whatsoever. But later, we haven't borrowed. And then this time, we have to borrow to revise the economy to help people affected. So it's quite worried to them. So I can assure that the money will be well spent. As you can see, this is why we have to transfer money to the targeted people via electronically, that to make sure that we would give to the right people. And the second is according to the 400 billion baht for economic recovery, stimulate the domestic economy. There's a committee under the NESDB to supervise, to analyze which one should be the entitled to get the budget. So it's not just spend as everyone wants. So they're quite strict. And Ministry of Finance is a member of that committee too. There's a number of agencies involved to consider which project will get this budget for the project that they propose. So like to make sure that the money would be well spent and would be the benefit of the country as much as possible. And although with this borrowing, we still have some room. As I mentioned, we haven't borrowed before. There's a big room actually. I actually, if you compare in European country, the public debt to GDP is pretty high. Most of them more than 100% to the GDP. For Thailand, before borrowing, this time only 40% more or less, and still have some room on under the fiscal and sustainability law. There's indicate that 60% of the GDP, but you see we still have some room. So I'd like to ensure everyone that the fiscal policy would be still healthy. Thank you very much.
คุณกลินครับ last thought to our 1,000 watcher online.
Last thought I think is the lesson learned from COVID. This one, the first one I think is the key success factor of this COVID period that I found. The first one is communication, very important. Whatever the government communicate throughout Thailand, so everyone listen. So especially doctor communicate, everyone listen. Good Hmor Thavisin every day, everyone listen. Okay, this is important. The first one. The second one is the collaboration between the government and also private sector. This is also important. And there's that collaboration. So another one is cooperation between the people in Thailand. I can learn that everyone cooperate. Everyone wear mask, everyone using, the cleanliness for the alcohol. Everyone's doing that with a high standard of hygiene. So this is very important. So we slowly opening up, and everyone can help each other. Right? And load Thai Chana, still people don't. Some of them don't load, but a lot majority load on that. And also I can see that the best practice in management COVID center, COVID center is very important. The best management, I think, is the combination. All the ministers work together. I think this is important for the government, and with the Prime Minister in the middle. So that's I think is a good model to apply. So the other day, Prime Ministers invite us to give what's our thought. So what I said, this is a good thing for COVID center. Can you apply this COVID center apply to Thailand right now for economic center? So he said, okay, good. So right now we set up already the economic recovery center. The first meeting was on 19 last week already. So this is very good. And then so I think this is the country will move on with cooperation with all ministries, not only part of ministry. So that's my lesson learned from COVID. Thank you, Kap.
Thank you very much. I think we pretty much conclude this first session on how we deal with the COVID situation, how to balance out economic as well as public health. I think a lot of the ideas that was mentioned, we have, as Kun Kalin rightly helped conclude, is that we learn a lot from the COVID situations. We have learned the experience, we have gathered data, we have learned how to communicate effectively to everyone, people, business, as well as public two-way communications. And most importantly, we have learned the model of working together through the COVID Center that is now being applied to the Economic Recovery Center that was just set up last week to help with the economic. So on that last note, on behalf of the Stock Exchange of Thailand, we would like to thank you, the three panelists, Dr. Phusit, Kun Ketsuda, and Kun Kalin for help share thought and experience as well as give confidence to our investors. And please stay tuned after the lunch break for our next sessions on how Thai corporate adapt to the new normal and what are the next move. So please give the hand applause to our panelists. Thank you.